Our fellowship program in endocrinology at WVU helps train people to become really proficient endocrinologists. In the clinical setting, we see absolutely everything here. We are a major referral center for the whole state and surrounding states, and we see a lot of unusual pathology. We have a lot of very nice patients who really appreciate our help. We can help them in person and on telemedicine, so we can have better outreach for the whole state. We also have inpatient care that we provide as consultants for neurosurgery, for orthopedics, for other medical departments, and they need our help regularly, so we again get to have a lot of great experience and training opportunities for our fellows. We have several hours a week of didactics that are scheduled into the day, and almost all of our faculty participate. Our faculty are very well versed in managing all kinds of endocrine conditions and love to teach. That's one of the things that makes me very happy to be here, is that our whole faculty really enjoys teaching. We are in general a warm and fun group of people, and we really enjoy what we do, both seeing patients and teaching. We also have residents that come through, and medical students and fellows are given the opportunity to help be the teachers in those circumstances. We also have our fellows rotate outside of our endocrine clinic and outside of doing consults for endocrinology in the hospital with gynecology and pediatric endocrine. We also send them to work with our bone specialists so that they can have extra experiences treating osteoporosis and other metabolic bone disorders. We have a gender and sexual minorities clinic that fellows rotate through. Very often applicants ask, do they get to do procedures? And the answer is yes. They have dedicated time spent in radiology doing fine needle aspirations of the thyroid. We also do thyroid ultrasounds several times a month in our clinic with our endocrinologists with our own ultrasound machine. And we can pull that ultrasound machine out every day and use that on our own patients, of course. And we have radiology rounds and pathology rounds. And then, of course, we also have our grand rounds, which provides lots of different ways to get education. We have board review, and then there's fellow directed board review, so the fellows get to have a lot of say in how they want to learn and prepare for their endocrine boards. So there's a very well-rounded way of teaching and gaining information, and it's a really nice and educational environment in which to learn. Every fellow is really required to participate in some form of research. It can be a QI project, it can be an actual research, investigative type of research. They also participate in a fellowship-wide fellow research academy that WVU has instituted for all of the fellows here. So they work with other fellows learning how to do research, how to apply for grants, how to formulate a good research proposal, and then they work with us as endocrine faculty, or if they have a cardiologist who's doing research that they find interesting, say in lipid research, then we happily reach out to other specialties to work with our fellows. As far as living in Morgantown, I really like it. I moved here from elsewhere, and I've been here now for 11 years, and I don't plan to move away. It's a very welcoming community. There's a lot to do, whether it's here in town or out in nature. I thought maybe I'd have to buy a kayak when I moved to West Virginia, looking at all the brochures, but if you're not interested in hiking, you don't have to. There's plenty more to do, but the beauty of West Virginia is really apparent, just driving 5 minutes away from clinic. We do have QI projects that go on regularly, and there can be interaction between the fellows and the other fellows, or with faculty or with residents. there's a lot of opportunities and a good supportive environment to pursue any of those. If you're interested in coming and participating as a fellow in our endocrine fellowship program, we would welcome you to apply. We all here are very enthusiastic about what we do every day, about our topic, about endocrinology, and involved in teaching, and very excited to pass that along to you. So if you are interested, please apply.